Measles is a highly contagious viral illness. It's spread person to person or through the air from an infected person. Over 90% of people who are exposed to someone with measles and are not immune will develop the illness. It's one of the most transmissible illnesses that we see.
So welcome, everybody. My name is Angela Carafazli. I'm Senior Director of Media and PR at York-Presbyterian. A couple of years ago, we started doing these media briefings on health issues that are relevant in the news. We did this as a way to make sure that we're answering every reporter's questions, because obviously we're getting a lot of inquiries around measles currently. So I'm joined today by Dr. Roy Gulick, who will talk about shed more light on the disease, treatment, and public health recommendations. Dr. Gulick is Chief of Infectious Disease at New York-Presbyterian and Weill Cornell Medicine. Today, he'll speak to you about the current state of measles, and then he'll answer some of your questions that were submitted in advance. You also have an opportunity, if you have additional questions, to submit them through the Q&A function on the bottom of the screen. Just note, it's not the chat function, it's the Q&A function. So now, without further ado, I'll turn the screen over to Dr. Gulick.
Thank you, Angela, and good morning. Measles is a disease of worldwide concern. The World Health Organization estimates that there are 10 million cases of measles that occur every year, and that's associated with over 100,000 deaths. Most of these occur in unvaccinated children, and most occur in Africa and Asia. Measles, in fact, was eradicated in the United States in the year 2000 and the rest of the Western Hemisphere in 2016. And what that means is that there's no ongoing transmission in the population in these countries. So all of the cases that we see in the United States are actually imported cases. They're linked either to an American who has traveled internationally or a foreign visitor to America. And in most cases, these are unvaccinated people. We're all aware of current outbreaks. We see outbreaks every year. The current outbreaks that are receiving a lot of attention are those in Texas and New Mexico, as well as Ontario and Quebec in Canada. Measles is a highly contagious viral illness. It's spread person to person or through the air from an infected person. Over 90% of people who are exposed to someone with measles and are not immune will develop the illness. It's one of the most transmissible illnesses that we see. Humans are the only reservoir or source of measles. Animals can neither be infected nor transmit the measles virus. Someone with measles is contagious 5 days before they develop the characteristic rash and through 4 days after they've developed the rash. And someone with measles who transmits it through the air, the virus can linger in the air for up to 2 hours. So that's what makes this such a contagious disease. Someone who's exposed to measles about 1 to 3 weeks after exposure will develop nonspecific viral symptoms, a fever, fatigue, cough, and inflammation of the nose, the mouth, the throat, and the eyes. This all precedes the characteristic rash. That rash typically starts on the face and then moves down the body in someone who develops measles. Most people with measles will improve within 2 days and achieve a full recovery. But the concern comes that about 30% of people will develop complications of measles. The virus disseminates, travels throughout the entire body. About 1 in 12 people will have intestinal involvement with measles, presenting as diarrhea. About 1 in 20 will have lung involvement with measles and develop pneumonia. And this can be life-threatening, requiring supplemental oxygen or even a mechanical respirator. One of the most feared complications of measles is when it travels to the brain and causes brain inflammation. Neurologic complications can include seizures or coma. And up to 1 in 3 in 1,000 people with measles will die from the illness. It is concerning. Rarely, measles can affect other organs of the body, such as the heart, or in some cases, the eye. Measles is a viral illness, and there are no treatments that specifically target the virus. When someone has measles, we manage their symptoms with symptomatic treatment, fluids, bed rest, drugs that lower fever, but there are no antivirals available for measles. The cornerstone of measles management is prevention. Those who were born before 1957 very likely had measles as a child, and that infection, that remote infection, confers lifelong immunity. But our best tool against measles, numbers 1, 2, and 3 for prevention, is vaccination. The measles vaccine was developed in the late 50s and early 60s and became widely available in 1963 in this country. This is a highly effective and safe vaccine. 1 dose of the measles vaccine will confer 90% immunity, and 2 doses raises that to 97%. So being vaccinated against measles is highly protective against developing the illness and provides lifelong immunity to those vaccinated. This is a safe and well-tolerated vaccine. It has never been linked to long-term complications, including autism. In fact, it's estimated that measles vaccines have saved over 90 million lives since the 1960s. Current recommendations for measles vaccine are that the first vaccination occur between 1 year and 1.5 years of life as a child, and then a second between the ages of 4 and 5. Currently, nationally, about 91% of US children have received vaccinations, but unfortunately, vaccination rates have been declining over time. So that's a snapshot of measles, where we are with the disease, how it's transmitted, what the clinical symptoms of it are, the fact that there is no current treatment, and that the cornerstone of what we should do about measles is to prevent it with vaccination. And I'm happy to take some questions.
Great. Thank you, Dr. Gulick. So let's take a minute to field some questions that we received in advance. The first, how many measles cases have we seen in the New York area this year?
So far in 2025, there have been 2 measles cases reported in New York, both in New York City. They were unrelated to one another, and both patients have recovered. However, in New Jersey, there have been 3 reported cases this year. The initial case was an unvaccinated American who traveled abroad, returned acquiring measles, and then spread it to 2 other unvaccinated people in New Jersey. And as I understand it, all 3 of them have recovered as well.
How does the current outbreak compare to the 2019 measles outbreak in New York City?
So 2019, we had a major measles outbreak in New York City with over 600 reported cases. The initial case was an unvaccinated traveler to Israel who returned and then spread it in a community where vaccination rates were low. And so that number of cases in that outbreak were quite severe. So the outbreaks that we're following this year in Texas are over about 150 cases. So similar, not quite comparable to what happened in 2019.
Got it. And what is the current vaccination rate, both in New York City and nationally?
New York City, about 97% of children who enter kindergarten have been vaccinated, so fairly high. Rates are lower across the country, and unfortunately, over the last couple of years have been falling.
And are there side effects associated with getting the vaccine?
So most vaccines, side effects are limited to local reactions, so pain at the injection site, or some can have fever or feeling unwell. Typically, these only last a day or two. There are no long-term complications associated with measles vaccinations.
And what rate needs to be maintained to preserve herd immunity?
So the concept of herd immunity means that a significant number of people in the population are vaccinated against measles, and that's to prevent further spread. About 3% of Americans have compromised immune systems, and that's related to either other diseases like cancer or advanced AIDS, or being on immunosuppressive medications for organ transplants or autoimmune diseases. So this population is very much at risk, and I should include newborns as well, who have underdeveloped immune systems. So the reason that we want herd immunity, that is for most of the population to be immune, is so that measles and other viruses won't spread readily in the community. The number is debated, but it's probably above 90 to 95% of the population. You want to be immune from measles to prevent further spread. And that's called herd immunity.
And are there home remedies or alternative treatments for measles, for example? And I see this question in the chat, is vitamin A, can vitamin A replace vaccination?
Vitamin A cannot replace vaccination. Vitamin A neither treats measles nor prevents measles. Why people are talking about vitamin A is that studies in developing countries showed that kids, predominantly with malnutrition, some had vitamin A deficiency. And so it was seen that if you gave vitamin A at the same time that you vaccinate people, they had better immune responses. Again, I'll say it, vitamin A is not a treatment for measles, is not a prevention for measles, and does not replace measles vaccinations.
There is a question in the chat regarding a recent death in New Mexico. So given the typical rate of death is 1 to 3 in 1,000, what do you make of 2 reported deaths among 150 cases?
Well, this is statistical. So 1 to 3 out of 1,000 is based on years of evidence. And then obviously you'd have to look at statistics to see if 1 to 2 out of 160 cases is really statistically different or not. I think the bottom line with this is death from measles is a rare event, but it can occur, and again, is completely preventable with vaccination.
And as a follow-up to that, do you feel there are likely many unreported or unconfirmed cases?
It's likely that that is true. People may develop measles and not report to health authorities or not come to medical attention. And as I emphasized, many people will fully recover. In fact, most people will fully recover without developing complications. So anytime we hear about cases, it's likely that there are underreported cases in the community as well.
And in terms of the vaccine, so is a measles vaccine always given with mumps and rubella as MMR, or can you just get a measles vaccine on its own?
Here in the United States, it is combined with mumps and rubella. So the typical MMR vaccine is what's available. We don't have a separate measles vaccine in the United States. Having said that, people who are immune to mumps and or rubella, or even measles, who receive MMR do not experience an increase in side effects from being previously immune. So it's safe to get MMR even if you're immune to one or all of the 3.
And as an adult, how can you confirm if you are protected, or do you need a booster at any point as an adult?
So the first thing to say again is if you were born before 1957, you're immune. And we know that from widespread studies. More recently, the people should have received 2 vaccinations. There was a time when 1 vaccination was given to people. Again, that would be associated with greater than 90% immunity, but may have left out some people. The way to know this is to go back and check your vaccination record or check with your provider. Again, many people may not have access to those records. There is a blood test that can establish immunity, and all providers have access to that test. So if there's any question at all, ask your doctor and see if you can get that blood test. That will definitively show if you're immune or not to measles.
And are you seeing any anecdotal evidence of more vaccine skepticism in the recent weeks?
It's disheartening, but since COVID, we have seen rates of vaccinations fall off. And this is really a tragedy. Vaccines really have changed human health in a major way. One disease to point to that was a scourge years ago was smallpox. That disease has been effectively eliminated and from the earth, and that was because of widespread vaccinations. We now have a host of vaccinations which can help people prevent these common illnesses. We've been talking about measles. We mentioned mumps and rubella. There's tetanus, there's diphtheria. More recently, of course, is the human papillomavirus vaccine. There's influenza, and then most recently, the COVID vaccines. And the list continues to go. So we really can change human health if people get vaccinated against these common illnesses.
So as a healthcare provider, how do you counteract this spread of misinformation about vaccines with measles or with other infectious diseases, as you mentioned, COVID?
Well, being direct with people and telling them what the pros and cons of vaccinations, why they're available, emphasizing that some of these are simple illnesses, but all can lead to complications. And as we've emphasized, some cases can result in death from these simple viral infections and bacterial infections. So healthcare providers remain among the most trusted authorities to the public for issues like vaccination. So one by one, we need to talk to people, inform them, counter misinformation, which is so prevalent nowadays, really stick to the facts and make sure that people can benefit from these really life-saving vaccinations that we have today.
So how concerned are you about a broader spread of measles, either now or in the future, if we start to see vaccination rates decline? And do you think that measles could come roaring back in the coming years?
Well, again, we eradicated this infection in the United States in the year 2000, meaning that there's no ongoing transmission in the population. Everything we're seeing is imported right now. If vaccination rates fall below 90 to 95%, we could very well see increased numbers of cases from outbreaks. And could this actually begin to spread in the population again? It's possible, not if people are immunized, not if people are immune to measles infection. Can't stress that enough.
And there was just another new question. So what are the dangers of measles parties trying to immunize unvaccinated children by interacting and coming into contact with infected people? And was this something that we saw in the 2018-2019 New York City outbreak?
The concept of measles parties, or really started as chickenpox parties, in other words, getting a bunch of children together for what's assumed to be a harmless viral illness and getting them exposed, is wrong. We should not be doing that. And the reason is that statistically, 30% of the children may develop complications from the viral illness. It's much safer to vaccinate your child than to be involved in this so-called measles or chickenpox parties.
And how do you think public health advocates should be framing the importance of childhood vaccinations when this is being positioned as an issue that is about personal freedom and not public health?
Right. We want to protect people. That's what's behind public health. And many of these childhood illnesses that we're talking about are unfamiliar to many people today because of vaccines that have largely eliminated them. So people are much less familiar with measles, mumps, rubella, or even chickenpox than they used to be. We've been able to really drive these illnesses to very low levels. The concept of public health is to try to protect everybody. So people should get the vaccination to try to protect people who can't get the vaccination because they are a newborn or because they are immunocompromised themselves. That's the concept of public health. I hate to put it in terms of personal freedom. What we're really talking about is illness in the population here. We all have a role to play here to protect ourselves, to protect our family and friends, and to protect people in the population.
And while we have you, Dr. Gulick, we did get a few questions related to COVID and bird flu. So I'll just read those off. How worried are you about the potential for bird flu to become a more direct and widespread threat to humans?
Bird flu certainly is a threat right now. We know it's widespread among mammals and particularly birds, as we've heard so much about. There have been reported cases in humans. Many of these have been mild. We just heard about the first death in the United States from bird flu. That was in an older person who had a number of other illnesses. So health was not perfect when they acquired bird flu. But bird flu has the potential to spread and actually become the next pandemic. When will that happen? Nobody knows for sure. These viruses can change. We know influenza viruses mutate over time. They can become more infectious, more transmissible, or even cause more severe disease. So we need to be prepared for bird flu and whatever other pandemic is waiting to happen out there.
And this question, so 5 years on from the start of the COVID-19 pandemic, what do you think are the most important things we've learned about stemming the spread of viruses and preventing another pandemic of that scope? And what lessons do we still not seem to have learned?
Well, that's a multi-part question there. COVID taught us a lot of things. The first is that a common virus that gets into the population that has never seen this virus before can spread readily throughout the world very quickly. So COVID became a worldwide pandemic within a matter of months. The other thing that we learned is that the public health infrastructure is critical to helping us both identify what's going on with transmission of infectious diseases and with responding to it. People are aware of the stops and starts and the changes and recommendations, but that's what medicine and science are about. You use the information you have today, and if you get new information, you change what you're saying tomorrow to make it more effective based on the data you have. The other thing I think we learned from COVID is that we can quickly use the infrastructure in this country to rally, to identify treatments, both treatments that work and treatments that don't work. And also, you have to look back and say that the development of the COVID vaccines was one of the greatest successes in modern medicine. Getting a panel of people together from the government, from public health, from pharmaceutical companies, and from doctors and scientists, getting everyone in the room and figuring out the most effective way to develop those vaccines in a short time, and then to get them out to the population, that saved millions of lives, the COVID vaccines. That was a new technology, and that developed suspicion. People were worried. How did this vaccine get developed so fast? Is it new? Has it been tested? Is it safe? But we know the answers to those questions. And new technology is not something to be afraid of with vaccines. In fact, we need these tools to keep developing vaccines that will be successful in the population. So COVID taught us that a pandemic can occur, and microorganisms do not obey country borders. They spread throughout the world. And we need to keep that in mind and be very aware of what's going to happen next. We need to be prepared.
We have time for one more question. So Dr. Gulick, what keeps you up at night?
Oh gosh. Well, number one is the declining rate of vaccine acceptability. The fact that we're questioning these vaccines that have saved so many lives and improved the lives of other people really does keep me up. We need to be strong advocates for vaccines. They really have changed human health and they benefit people greatly. The second is what I just referred to. Microbes, organisms do not respect country borders. we need to collaborate with our international partners. The World Health Organization and other groups around the world help us provide public health right here in the United States. We need the people who are providing surveillance, who are monitoring, who are working together to contain outbreaks, prevent spread, and can treat people who develop illnesses. So both of those things really, really do keep me up at night. And then the third is pandemic preparedness. Are we ready for the next pandemic? I'm concerned that over the last 3 months, things are changing in this country, and that a very good public health infrastructure that we have, both on the local level, on the state level, and on the national level, is being changed. And I'm very concerned about that.
Yes, me too. Well, thank you so much, Dr. Gulick, for your time.